Okay, so we have a few people here, which is excellent. We have a few guys in the audience too, which is even better because all of us need to be advocates for women's health. And so what I'm going to talk to you about today is that in 2025, periods and period problems are still so incredibly taboo. And women don't talk about it, and it affects quality of life. It affects women's ability to function, to take care of themselves, to take care of their families, do the things that they want to do and enjoy doing. And it's really all of our responsibilities to be able to advocate for our health with this. This just came out yesterday in Nature Medicine, where we actually talk about this exact problem, about ending this taboo of period and period problems. So the big question is, do you have heavy periods? And you know what, there's so many different definitions of heavy periods, but your period, if you have, you have to change sanitary protection during the night, you have heavy periods. If you feel faint or breathless during your period, that's another symptom. If you plan your life around your period, that's a problem. That's not normal. And the list goes on and on. Excessively long, frequent, and unpredictable periods. If you're on the toilet and passing large clots, that's abnormal. Worrying about bleeding or bleeding-related accidents. I have lots of patients come to me and say, you know what, I plan my clothes around if I know I'm gonna have a period, and making sure that I am having that extra protection or wearing black, just because I don't want to embarrass myself in front of people. And if you're changing sanitary protection more than every 2 hours, that's heavy. And so all of these things, this has been normalized. These periods, all of the symptoms I showed you before, people say, oh my gosh, my sister has the same thing, and my mom has the same thing, and my grandma had the same thing, so it just doesn't matter. This is normal. This is a normal part of being a woman. And if there's one thing I can say, is that it is totally not normal, and you need to see a healthcare provider to be able to fix it, because there is a solution. So overall, what is heavy periods is this. Heavy menstrual bleeding is excessive blood loss that interferes with a woman's physical, social, and material quality of life. So if your quality of life is affected, your periods are heavy, and you need to see somebody about this. And so this just got launched a few months ago, and it is a fantastic website from the UK. And in fact, it goes through a survey to say, do you have heavy periods, yes or no? And if you do, what are some of the things that you can do about it? And when you go to your doctor, the issue is that primary care providers are so busy, and they don't necessarily know everything about what heavy periods are. So it is your responsibility to actually tell your primary care provider, because the questions you should be really being asked is, how heavy is your bleeding? How many pads do you change daily? How frequently do you need to change pads? Do you wake up in the middle of the night having to change products? Do you experience flooding or clotting, or how frequently? And do you have problems with soiling linens, and how frequently does that happen? Do you need to stay at home, or do you plan social activities around your periods? And if you say yes to any one of these questions, you have heavy periods. There are so many causes of heavy periods, and there's somebody who just asked me earlier, is that, my doctor did an ultrasound and it was absolutely normal. It doesn't necessarily mean that there is no problem, because you can have endometrial disorders, whereas issues at the lining of the uterus that cause heavy periods, and there is treatment for this. And so when you think about, everybody here gets really scared when we talk about hormones, and that's okay. But I just want to tell you is that there are non-hormonal options and hormonal options that are very effective in treating heavy periods. And the simplest is a non-steroidal anti-inflammatory that you can get over the counter in a pharmacy. So if you can take your Advil just on the minute that you're having your period, like on a regular basis for 48 hours, you're going to decrease your menstrual blood loss by about 50%. Tranexamic acid is another non-hormonal medication, but that's something that your primary care provider or your gynecologist needs to give you. And so this is our website, and it is a patient-facing resource that is a complete guide to heavy periods and iron deficiency, and that's kind of the what I'm going to be talking about and what we're really passionate about. And it tells you exactly what to do and how to deal with some of these issues. The one thing that I want to say is that of menstruating women, 50% of them will have heavy menstrual bleeding at some point. But what is most important is that this heavy menstrual bleeding is just one point in the life cycle. But what this leads to is a whole downstream effect, because we know that about 2/3 of women who have heavy menstrual bleeding are also iron deficient. And if you're iron deficient as a woman, you're more at risk and you end up going into pregnancy and becoming pregnant. You are at risk of adverse pregnancy outcomes because it takes 1 gram of iron to grow a baby. And then in the moms who are iron deficient, there is an increased risk of neurocognitive issues for their babies. So it starts at heavy menstrual bleeding, and especially in patients who are reproductive age before they want to get pregnant. This has significant life course effects, and that's why it is extremely important that we think about it, because we know that even kids who are born to moms who are iron deficient are more likely to be iron deficient then, and then the cycle just perpetuates itself. And so what's important is that 2 in 3 women with heavy menstrual bleeding will have iron deficiency or iron deficiency anemia. And when you look at the symptoms of iron deficiency anemia, or iron deficiency, the symptoms are fatigue and weakness, shortness of breath, difficulty sleeping, restless leg syndrome, dizziness, fainting, feeling cold, especially like in winter, you're just like, you can never get warm, rapid heart rate, and headaches. The problem is that these symptoms are usually chalked up to just being a woman. People say, oh, you feel tired. Oh, you have headaches. Oh, you feel cold all the time. That's because you're a woman. That's part of being a woman. And that is not the case. These are symptoms of a medical problem called iron deficiency. And when we look at women who have iron deficiency compared to those who don't have iron deficiency, we see that those who are iron deficient have actually lower IQ points than those who are not iron deficient. So there's a cognitive impact. If you look at physical function, those who are iron deficient actually have less exercise capacity than those who are not. And most importantly, quality of life is affected in those who have iron deficiency compared to those who don't. Now, if I say to you, look at these symptoms: low mood, low interest, decreased appetite, thought slowing, less movement, fatigue, and reduced concentration. Okay, so you look at these symptoms, those are actually symptoms of iron deficiency. But what is really interesting is that there is such an overlap with depression. And so specifically in women who are experiencing low mood, you should see your family doctor, your primary care provider, to see if iron deficiency is actually a contributor to your low mood and your low mood symptoms. And so this is what I was saying, is that the problem with iron deficiency is you have heavy menstrual bleeding, you're losing more iron every day than you're actually able to take in because you can only absorb 1 to 2 milligrams of iron. If you become pregnant, it takes 1 gram of iron to make a baby. So you're already behind the 8 ball. And then during pregnancy, you have an increased risk because of your iron deficiency. The issue is a lot in our adolescent population, in our teens who have these new types of diets that we can never keep up with. They have increased exercise. Our teens are in so much sports, and at the same time they have heavy menstrual bleeding. And so the cycle starts when you're a teenager. And when you're a teenager, if you have iron deficiency, you actually have issues that extend beyond. And in non-pregnant women, the heavy menstrual bleeding is an issue. In pregnancy and postpartum, that is exacerbated. And then perimenopausal, you're more likely to have abnormal bleeding and more likely to have iron deficiency. If you're going for surgery, and a lot of people go for surgery, the one thing that we're trying to get across to surgeons is that not to do surgery until patients' hemoglobins are more than 120. So this is what you can do to advocate for yourself. Make sure that you're not anemic going into surgery. And there are excellent guidelines that say that you do better with recovery from surgery if you're not iron deficient going into surgery. So the approach is, number one, you stop the bleeding. Number two, you treat the iron deficiency. And three, plan for surgery. And what I usually equate this is to a bathtub. Bathtub is your reservoir of iron. You can drop in iron by taking oral iron because you absorb 1 to 2 milligrams of iron pills that you take. Or what you can do is get IV iron by really quickly giving intravenous iron. But the issue is, if every month you're hemorrhaging, you're never going to be able to fill your bathtub with iron. And so you have to stop the bleeding in order for you to fill your bathtub of iron. And so this is what I've talked about, but what we also know is that patients, this is an issue that affects more vulnerable patients far more than it does others. And so this becomes really a health equity issue also. So I'm going to conclude by saying that iron deficiency is this intersectional storm. It remains the most common micronutrient deficiency globally. It affects about 2 billion people annually, and it is the most common cause of anemia. It disproportionately affects women and is the leading cause of decreased quality of life. And the thing is that it's correctable, and you just need to talk to somebody about this and be empowered to tell your primary care provider about this. So any questions for me? Okay. No questions whatsoever. There you are. Excellent. How's it correctable? Yeah, that's a really good question. So how is iron deficiency correctable or heavy menstrual bleeding? Iron deficiency? Yeah, really good question. So number one, you have to stop the periods. So it's like that bathtub, you need to every month stop hemorrhaging. So it doesn't need to stop, it can decrease your periods. And so you can actually go to that first thing, there's non-hormonal and hormonal ways. Then there is oral iron that you can take. Now when you go to the pharmacy and you see a ton of oral irons, you're like confused. Like, what do I order? What do I not? A lot of this is also behind the pharmacist's desk, so it's hard to know. But to be simple, you take an iron salt, which is over the counter, something like Palifer, ferrous fumarate, or ferrous gluconate, and you take it every day or every other day. The problem with iron is that it sucks to take. It upsets your stomach, and it can be a problem. So if you go to our website here, and I'm going to put this back up again, this website actually tells you about how to take your iron. So you should have it with lots of water. You should take stool softeners with it. And so that is the number one way to correct the iron deficiency. And second, if it's not working, you take it every other day. It's still better than not taking it. And then the third way is intravenous iron to correct the iron deficiency. A lot of people ask me, what if I eat spinach? What if I eat more leafy vegetables? If you have iron deficiency, you can never correct your iron deficiency by just diet alone. You need to have more supplements. Diet is great for prevention, but for treatment, it's not great. So I hope that answers your question. Yeah. Yes. Yeah. Yeah, so the question is, the iron fish, is it good or not? Again, iron fish is great for prevention. If you already are iron deficient, it doesn't work. You can never get enough iron with that iron fish to be able to correct your anemia or your iron deficiency. So being on some sort of iron supplement is important, but it's great for prevention and to be healthy as part of your repertoire. Yeah. Yeah. Yes. For iron deficiency. So the question is, what are the specific aspects of disability with respect to iron deficiency? Did I get that right? This is it. You feel tired. You feel weak. You feel short of breath. You have troubles concentrating. You have headaches constantly. You feel cold. You feel exhausted. Like, 6 o'clock comes around and you're like, I'm not sure how I can do this. And so those are all aspects of quality of life that are diminished with iron deficiency. Yeah. And so those are the aspects of disability associated with iron deficiency. And in the South Asian population, actually, the iron deficiency is far more common because of our diet. And a lot of us are vegetarian. And so getting enough iron in from our diet is a problem. And then if we're losing iron in another way, then that exacerbates the problem. If you are postmenopausal or you're not menstruating, not having periods, and you're still found to be iron deficient, you should make sure that you're getting your colonoscopy done, because that's the second most common way of losing iron is through the GI tract. So that's something that you should keep in the back of your mind. Yeah? Okay. Yes, a question at the back.
My question is, when we do take the medication, like the iron supplements, and if we do take medication for managing our periods, is it like a lifelong process, or is there, because sometimes people, I've heard like doctors say themselves that you can't take iron for too long, maybe you have to break it in between, and so I don't know how that works. Like, is it a long-term thing that you have to do, or there would be a break in between?
Yeah, that's a really good question. I think acutely, you need to get your periods under control. If you are losing more blood than iron that you can take in from your diet, you're in a negative balance. And then if you're doing extreme exercise or you're going to get pregnant, you're just going to go, if your iron demands are higher, you're just going to go lower. But if you get your periods under control, and it doesn't mean taking your periods away completely, if your periods can be normalized, and that can be with an intrauterine device, that can be fixing the problem. Sometimes it's a fibroid. Once that's fixed, your periods are back to normal. Then you must take your iron until your ferritin level is over 50, so you've replenished your stores, and then just diet is fine. You do not need to be taking iron for long periods of time. I do want to correct one of the myths that you said. Sometimes doctors will say you can't be iron for a long period of time. That's wrong. You actually, what's worse is being iron deficient for a long period of time, because then the consequences on your heart, your brain, because what does the body do? You're iron deficient. Where do we use iron? Like, what's the number one place where we use iron? Anybody know? It's actually the blood, right? Like, it's hemoglobin. So the body, what it does is, but you're right, iron is used everywhere. It's used in the brain, it's used in the muscles, it's used everywhere. But predominantly, it's used to make blood. So now if you have less iron, what the body does, it preserves making blood. It does everything it can to make your red blood cells. So it funnels all the iron that you have to make your red blood cells, and guess what it suffers? Your muscles suffer, your brain suffers. And so that's why you have restless legs. That's why you feel cold. That's why you have decreased concentration and headache. So that's just the body's way of preserving hematopoiesis, which is making of blood. Great questions, yeah.
Can any of the iron deficiency symptoms that you're talking about lead to pain as well in your muscles or in your legs?
Yeah, so it actually could lead to pain in muscles, and that has been shown, and especially in the legs, absolutely. So that can be a symptom of iron deficiency. A lot of people also will, one other symptom is like if you're craving ice, that's another big symptom. I do want to say you brought up pain, which is really great, because a lot of patients with heavy periods also have significant pain. And that's another symptom for young people, for endometriosis, which is another common condition that goes along with heavy periods in young people. Yeah, one more question. Yeah, so if your question is if you have a pre-teenager who is not yet having their periods and is already iron deficient, the number one thing you can do for them is get their iron repleted. And you can do that with intravenous iron as a number one thing. The reason is because we see that you have a decrease in your concentration. So this actually affects school. And these young kids are going to school, like, if there's one thing you can do to improve their performance in school is actually get their iron deficiency corrected. And that can be orally or very quickly through intravenous iron. You should also make sure what is the cause of that iron deficiency in that young person. Is it diet or are they losing iron in any other way? So that's something to think about. Yeah? Okay, thank you guys. You've been such an interactive audience.